So I'm Colin Geddes, I'm one of the consultant nephrologists at the Queen Elizabeth, and I'm just going to show you some snippets of my day. So this week and for the next 2 weeks as well, I'm covering inpatients for the what's called the Green Team in the renal service. So what that means is that each day I'll be responsible for the care of a group of inpatients on the ward. My colleague handed over the patients he'd been looking after last week to me, and I've just been looking at it on my email and picking up all the cases. I think we've got about 10 cases to go and see, and I'm going to go to the ward round after this. I'm going to answer some emails just now. Just been phoned from home to check that I fed the dog. So life goes on outside the hospital. And I've got changed into my blues, which I'll wear all the time when I'm in the hospital. And I'll also be wearing a face mask outside of my office and on the wards at all times. Okay, so I'll give you some more information later on. We're room now, and we're just doing a handover in the morning of all the patients that have come in over the weekend and all the problems, and they've been handed over. Ilse was on overnight, she's looking quite tired, but she's doing well, and she's handed over the problems. So we're now just about to start the ward round. This is the ward sister and the nurse practitioner and the junior doctor on the ward, Elliot, and so we're going to start the ward round, and we start by talking about who are the sick patients. So it's now 11 o'clock, and I'm just writing the case notes of the first 7 patients that I've seen, documenting the plan for today. And Elliot, the junior doctor, he'll work with the nurse practitioners to make all the changes to the medicines and plan all the investigations and referrals to other departments that have arisen from the ward round so far this morning. So now the laboratory results from the patients I saw this morning on the ward, they should all be back now. So I'm going to go through them to see if we need to make any changes, and if we do, I'll then telephone up to the ward to let the junior doctor know what changes need to be made. And I've also got to speak to the wife of one of the patients and the daughter of one of the patients to give them an update on their relatives' clinical progress. One of the things we spend a lot of time is dealing with emails. We do a lot of email communication about admin and patients. And nearly every day there are updates from the management about various aspects, and this is included in a thing called Core Brief, and today's information is about the introduction of reusable respirators and some information about car parks, but it can be a whole variety of things. I'm just writing a supervisor's report for a PhD that I'm co-supervisor for, which is an interesting project on a disease called vasculitis, and I'm having to report on how we've had to adapt the research project because of the COVID pandemic. So it's now evening, and I'm at home and I'm now spending some time doing some work. I'm reading some journal articles about some new things. So tonight I'm reading about what drugs to select for treating high blood pressure in dialysis patients, and also about some new studies of genetics and different types of kidney disease. So here's this article that I'm reading at the moment, and this will hopefully provide some useful information, because I get asked to adjust medication in people on dialysis to treat their blood pressure quite frequently. So I'm going to spend some time reading that. One of the things we do is to try to keep up with developments in medicine, particularly in our own field. So this is an online version of a very well-known journal called the New England Journal of Medicine, and I've got it set up so that it sends me summaries of articles that are of interest to my specialty. And this is a picture that's been published of somebody who's got a kidney in the wrong place, and I can read about that. So there are much better ways of accessing information and trying to keep up nowadays, but there's a huge amount of stuff that's published that we need to try and keep up with. It's difficult to find the time for that. So this morning I've been seeing what we call outliers. So this morning I've been on the wards going to see patients that we call outliers. What this means is that it's patients who have got kidney disease and are referred to us by other specialties to ask for advice with the kidney problems, and at any one time in our unit we might have 50 of that sort of patient across different hospitals. So I've been going to the Queen Elizabeth wards today, I've been on to the vascular surgery ward, the stroke ward, the geriatrics ward and the surgical ward, and in fact one of the patients I've been discussing with the surgeon, we've decided it would be better to transfer them to our unit to manage the kidney disease problems, as that's becoming more of an issue for them. So I've arranged that transfer. And then I've also been up to the ward that I was on yesterday, doing a ward round to see if there are any new problems in any new patients. And there was one new patient who's come in, a patient who's on dialysis, who's got the chest infection. So I've helped the junior make a management plan for them. And then this afternoon I'm about to have a meeting with our transplant coordinators to discuss a way of extracting information from our database on all the patients who are on the transplant waiting list, so that we can send an email to the consultant looking after the patients on the waiting list once a year to check that they're still fit and they've not developed any new health issues. So that's a sort of computer programming and a logistic challenge to create a foolproof system that will work, and we're quite optimistic that we'll get somewhere with that. So I'm going to have a bite to eat now. So I've met with the transplant coordinators this afternoon, and we've managed to tweak the query in the database so that it gives us a reliable readout of who's on the transplant waiting list and whether or not they've been reviewed by their consultant within the last year to make sure they're still okay for the transplant waiting list. So that's good. I've just had a phone call from the junior doctor on the ward to say that the patient we transferred today has become less well, and to discuss the plan for treatment with me. And I'm going to go and see her later on. And then I'm just working just now on another query of our database, because we've noticed that we think a medicine that we use quite commonly in dialysis is causing a mild allergic reaction on the blood tests, and it's not something that's been recorded before. So I'm looking in the database all the patients who've been on that medicine and their blood results to see if we can confirm that that is an association, and if that is the case, then we will report that more widely. So it's now Wednesday morning, and just going up to the ward to do the ward round. There's been a few emergency admissions overnight, so the consultant that's on overnight has just texted me to say, can you phone me to give me a handover of those new emergency patients. So that's me just finished a ward round at 1 o'clock. It's been quite busy because there were quite a few new admissions who were quite complicated, and one of our patients needed to get a biopsy of their kidney. That means a piece of their kidney taken out, and we'll get the chance to look at it on the microscope later on, probably tomorrow. So I'm back in my office now and doing some admin. That'll involve signing letters electronically on patients that I've seen in clinics and patients who've been discharged from the ward under my care. Those are letters that go to the GP advising them of what's been happening. And there's also various other admin responsibilities. Got a meeting tomorrow to discuss possibly changing the antibiotics that we give people who are having a kidney transplant at the time of their transplant. So I'm going to try and extract some data from our database to see how many infections we're getting with the current antibiotics we're using, and that'll be used to determine whether we should make a change, and if we do make a change we can compare how we got on after we made the change with how we got on before the change to make sure it's been effective. What I'm about to do now is to complete what's called a work-based assessment for one of our trainees. So there are different types of workplace assessments. We witness them seeing a case, for example, or discussing a particular case, or we witness them doing a ward round, or witness them doing a procedure, and we give constructive feedback to them directly, and also via this system called ePortfolio, which is a record of their training. So I'm about to complete what's called a mini KEX, where I had sat in on a consultation that one of our trainees had done, and they did very well, explaining to the patient that they're likely to need kidney replacement treatment in the future, and discussing dialysis and transplantation with them so that the patient can make an informed decision about that. So the things I'll be asked is about their communication skills, their professionalism, their clinical diagnostic skills, and various other aspects, and then asked to give some constructive advice about what could be improved in the future. So I'll do that just now. So this morning's been a busy morning. Again, I'm covering inpatients. I had intended coming in to catch up with some administration, particularly in relation to patients who'd been discharged last week, making sure that the plans were in place for their follow-up. But I got a call from the junior doctor on the ward to say that one of the patients had become very unwell overnight, and then particularly the first hour this morning. So I went up to the ward, and unfortunately it was clear that the lady was dying. This hadn't been entirely unexpected, although we hadn't anticipated at this particular time. We had warned the family about this possibility, but it was still quite distressing for them. So we're just about to start our monthly multidisciplinary team meeting for transplantation. This is where we discuss some of the challenging cases in terms of making a decision about whether kidney transplant's the right thing for them, what the surgeons are going to do in terms of the operation, and how we're going to manage it afterwards to try to prevent the transplant from rejecting. We don't discuss all cases in this meeting, just challenging ones, and then after that we discuss some of the challenging cases of people who've been transplanted. So we used to sit in a room and discuss each case and make a record of what the decision was, but now we do the meeting by Zoom. So last night I had to go and see a lady over in the labour ward who's developed kidney failure after delivery of her baby, and I went back to see her early this morning, and it looks as though things are improving, which is good. We thought she might need to be transferred to us to get some dialysis treatment, and I've been doing a ward round this morning, the rest of this morning, and now I'm about to join a meeting with the Scottish Government representatives and representatives from the other transplant unit in Scotland about contingency plans should there be another surge in COVID, and we're trying to work out what we could do to minimise the risk that patients who need a transplant won't get a transplant because one or other centre is closed. And that meeting is going to be on Teams, which we're now using a lot to avoid being in the same room and also avoid travelling. And then in the afternoon I've got a meeting with the PhD student that I'm co-supervising to work out how we're going to extract data from the electronic patient record for his project. So today's been quite a busy day. In the morning I went to Gartnavel Hospital, where we're currently doing what we call our acute transplant clinic, so that's seeing people who are within the first year after transplant, and I saw 8 or 9 patients there, one of whom had to be admitted because their blood sugar was very high, and one of whom has got some rejection of the transplant, so needed to be transferred down for some outpatient treatment for that. The other ones were doing fine and getting the benefit of their transplant. We just made some minor adjustments to the medications once I saw their blood results this evening. And then at lunchtime, came back down to the hospital to speak to the daughters of one of the patients who's really having a difficult time in the ward, just trying to think about what the options might be for the future, including the possibility of end-of-life care as opposed to continuing with active management. So that was quite a long conversation, but it was constructive, and the daughters were very understanding of the position.
So one of the things that's very important in medicine is teamwork, and in the renal unit we're very keen on teamwork. So one of the things that was devised by some of our trainees was on a Friday in the morning, one of them is allocated to bring in cake, and we take a break in the ward rounds for 5 minutes to have a coffee and some cake. And today's cake over here, you can see crispy creme donut. Other donuts are available.
Okay, so